Okay, so similar to how we figured out the right working end for the max anterior, it's going to be the same for the mandibular anterior. So you're lining it up like you're about to use it, and you can clearly see that that terminal shank isn't lying flat against the tooth. But when I line it up this way, the terminal shank looks like it's lined up perpendicular, or I should say parallel to the long axis of the tooth. And again, alternatively, when I'm holding my Explorer this direction, I can see that that functional shank bends to the left. The first bend is going to the left, and so that's a visual clue that I have the right working end. So if I'm going to start with my surfaces away, again, I try to start close to the midline, but it's tricky because they're tiny teeth. These ones are a little bit larger. So I tend to start more at the line angles, and you're doing tiny little overlapping strokes. You don't want to go too deep on the mandibular interior. They're not very thick teeth. You work your way up, you get under that contact, tip your handle, and then just trace up the contact. And at this point, I want to make sure that I do my surfaces towards, but I'm sitting at 12 o'clock, and 12 o'clock is where I want to be sitting to do my horizontal stroke. So I'm going to flip my instrument, and I'm going to, I can't remember which tooth I used, I'm going to do my horizontal stroke now before I come around to 8 o'clock or 4 o'clock for the lefties to be able to do my surfaces towards. So now I'm coming around to do my surfaces towards. I already know that I have the right working end because I've just flipped it, and I'm going to again insert, try to get close to the midline, but it's tricky because they're narrow, so it tends to be more towards the line angle. Tiny little overlapping strokes, making sure to always keep 2 to 3 millimeters adapted, and then you tip when you get to the contact to work your way up that contact. There's a composite there, and remove the composite and then work your way out.